Hello and welcome to another episode of Let's Talk Health. Today's session will be on cosmetic gynecology, and to discuss this, we have with us Dr. Jyoti Kankanala, Senior Consultant, Obstetrician Gynecologist, Laparoscopic and Cosmetic Surgeon, practicing at Citizens Hospital, Hyderabad. Good afternoon and welcome to our show, ma'am.
Thank you.
So, my first question is for you, ma'am. What is cosmetic gynecology and how does it differ from traditional gynecology?
Cosmetic gynecology is an evolving branch to maintain the genital harmony. It is designed to enhance the feel, function, and appearance of the female sexual organs or the second phase of the women. It's not that traditionally our ancestors were not following any cultures to enhance the sexual pleasure, but still this has come in light because of various social interaction and media help, and also because it has been included as a subspecialty branch in obs and gynae. Cosmetic gynecology is an evolving branch to maintain the genital harmony. It is designed to enhance the feel, function, and appearance of the second phase of the women. Traditionally, also our ancestors were following certain cultures to enhance the sexual pleasures and also cosmetically dealing with the private parts. But it has come in light recently because of a lot of social interaction and media help. And also it has been involved as a subspecialty branch in obs and gynae. Traditional gynecology and cosmetic gynecology, they both go hand in hand because both are aimed to improve the quality of life of women. However, in cosmetic gynecology, we deal with the perception and to give psychosocial well-being to the patient. In traditional gynecology, if you are pregnant, the baby has to be delivered. So there's a bit of a difference in both of them. Thank you.
My next question is, ma'am, can you provide an overview of various procedures falling under cosmetic gynecology?
There are various procedures, so we'll divide it into non-surgical procedures and surgical procedures. The most common non-surgical procedures are peels because of the darkness and discoloration and pigmentation of the private parts. A lot of people, they come for peeling purpose. Fillers, if they feel that the fat deposition is a bit odd, they come for fillers. And the other procedures are mainly depending upon the need. For sexual satisfaction or enhancement, there are injections over to the O spot and the G spot. And also patients, they come for various painful sexual problems. So for that purpose, we inject Botox. And this is called vaginismus. Condition is called vaginismus. And the other conditions are like stress urinary incontinence. That is, the women, they leak during coughing or sneezing. So mild stress urinary incontinence can be tried with laser, and recurrent urinary tract infection can be prevented because dryness can be relieved because of laser. And also we can try for recurrent vaginal infections. Definitely we have to properly examine, do the swab test, rule out any candida infection or any other bacterial infection, and then as a last resort you can try laser for this purpose. And for moms, as they deliver, they might have few concerns about the scars over the abdomen, and for that purpose we do lasers. And a lot of people will have concerns about the episiotomy scars, so we have to examine and see if anything can be done for that. And if it is to be done, then it will be laser procedure. And for vaginal tightening also, the patient like to get advice for vaginal tightening. There are various procedures, again laser and surgical. So surgical also involves the vulval lip has to be decreased for some people if they feel it's a hanging vulval lip, vaginoplasty, hymenoplasty, and repair of the mons pubis. So these are the surgical methods.
So the next question is, ma'am, what are the common concerns or reasons why women seek cosmetic gynecology procedures?
Firstly, women will never come as they would like to seek help from a cosmetic gynecology. So, but as the history evolves, slowly you should try to understand the reason why she has come in, because immediately they might not open up. So therefore, time is important. So I feel as a cosmetic gynecologist, it should be in the evenings when all the other OPDs have done, or during the Sundays for 1 or 2 hours, because definitely it is time taking to understand. And the common reasons why people visit to us is mainly darkness of the private parts, having problem while wearing the inner wears or jeans because the labial lips are hanging and they are interfering with the day-to-day lifestyle, and difficulty in cycling, they are not able to wear the bikini. These are the most common complaints. The others are sexual dissatisfaction or sexual pain. This has to be dealt once you clinically rule out other problems, then we can deal with these issues. And also stress urinary incontinence, mild or moderate. So definitely the other process like physiotherapy and other things we tell, but also as a cosmetic gynecology, we should be able to give the other options. Vaginal dryness, vaginal infections, these are also the common conditions for which people visit to us.
So the next question is, ma'am, could you discuss some of the most requested cosmetic gynecology procedures?
Most of the common procedures are peelers because they want to reduce the darkness, discoloration, pigmentation of the private parts. The others are fillers. And as I said, like once we talk to the patient, we will come to know. Then if needed, we have to guide them that it can be Botox injections, and also if needed, other procedures can be spoken about like lasers for the stress urinary incontinence and other lasers for the episiotomy scars and lasers for the abdominal scars, if any. Thank you.
The next question is, ma'am, how safe are cosmetic gynecology procedures and what measures are taken to ensure patient safety?
Good question. The cosmetic gynecological procedures are usually very safe because they are considered to be office procedures. And this is for the non-surgical method. For surgical methods, definitely we take all the safety precautions as for any other procedure. And also for the non-surgical, we take all the safety measures. We assess the risk and benefits, and also all the infection control. Everything is taken place as per any other procedure. Thank you.
So the next question is, ma'am, are there any potential risks or side effects associated with these procedures?
Any procedure, if you're touching a patient, there is always a risk of some problems. So what can be those problems? If they are non-surgical, it can be injection causing allergy, it can be redness, burning of the site. And if it is a surgical, there can be blood clots, there can be hematoma, the scar can not be healed properly, the scarring might not be good. And at the last, the major complication can be that we are not matching up with the expectation of the patient. So because these are all perception and psychosocial well-being to be given. So if we are not able to provide that, that itself is a major complication.
So the next question is, ma'am, so what is a typical recovery period for various cosmetic gynecology procedures?
Again, this we have to divide as surgical procedures and non-surgical. Non-surgical procedures, usually the recovery time, as we said, that within half an hour they can go to their office. Surgical procedure, depending upon whether they are going in for labioplasty, whether they are going for a hymen repair, or whether they are going for mons pubis repair, or whether they are going for vaginoplasty. Then depending upon the type of the surgery, the recovery time can be from 2 days to 3 weeks also.
So my next question is, ma'am, is cosmetic gynecology a single specialty or you involve any multi-specialty teams in this?
So we cannot tell immediately, but once we see the patient and decide about the type of the procedure, there's no harm in involving plastic surgeon and urologist. Depending upon the type of the procedure you're doing, if you're doing labioplasty or vaginoplasty, always better to inform the multidisciplinary team members like plastic surgeons and urologists a day or 2 days before, and then consult with them and then take up the patient rather than informing them on the table. And so that they can be prepared and they will also understand, because in some events of vaginoplasty or any other procedures, sometimes they need MRI scan and other things. So therefore, never ever call the multispeciality team on table. Always inform them prior to taking up for the procedure. And there is no harm in involving the multidisciplinary team members. It's always safe for the patients. Thank you.
Ma'am, this is the last question from my side. So, how do you concern the patients who come to you, and what type of suggestions would you like to give?
Sure, a very good question. Consenting can be very tricky in this case because we are dealing with the perception of the patient and to give her the psychosocial well-being. So perception to enhance the feel, the functionality and appearance. So all this is what the patient will tell you. So if you mismatch her expectation, it can be a disaster. So therefore, always try to see what are her expectation and never ever hesitate to tell that you can't achieve that or you can't go beyond that. Because this will help the patient not going in for the procedure and she will understand. So counseling is important because sometimes we also see that patients, they come and they don't understand that this is a normal anatomy, and once we counsel them repeatedly, they are all fine and they don't even go for any procedure. So therefore, whenever the patient comes with any concern, detailed history, creating a rapport, and let them go home, absorb the problem or understand what we have said, because it can be a normal anatomy, because there's no consensus on what is normal, because it is only the perception. So definitely let her go home, come back again and then have a sitting again and see whether really she wants to go for it, or let her absorb, tell her to read things and then come back in another 10 days time, or in fact 1 month or 2 months. But give her time, never take the patient on the same day, especially in cosmetic procedures. Secondly, whenever we are consenting, the photography, and also you should have somebody with you who can be your colleague or, as I said, multidisciplinary team member, so that they will also understand what is going on with the patient's condition. And while consenting, you will have somebody along with you so that you understand along with the another subspecialty person, and let the patient also come along with their relatives or friend or boyfriend, so that they also understand doubly and think if they have any other queries and they can come back. So this should not be done, as per my opinion, as a one-day process. Like, this should go on so that the patient understands better. Then photographs and other things which the plastics they already take, we should also try to take with the consent and proper confidentiality maintenance. And in consent, definitely if it is surgical, it's needed. But in outpatient also, if we can start taking, that will be of great help. Thank you. Then routine consent, the type of the procedure, the complete name of the procedure, why we are doing the procedure, then benefits of the procedure, the risks of the procedure, long-term risk of the procedure, and also that we might not be able to match up with your expectation, you have to mention there. And thirdly, if we don't do the procedure, what are the alternative methods? And suppose if we just follow the alternative methods, what are the risks associated? So all this should be signed by the patient, the witness, and everybody. Thank you.
Thank you, doctor, for your valuable time and inputs. So with this, we conclude today's session on Let's Talk Health. We'll be back next week with another episode. Till then, take care and be safe.
Thank you.